Hi, I'm Sam. I'm a fourth year medical student from Darlington. I was diagnosed with bipolar disorder at the start of 2017. So I had a manic episode. It's not a particularly well kept secret, so I feel pretty comfortable talking about it. And I was detained at the Royal Edinburgh Hospital for 4.5 months in 2017. So, and if anyone wants to talk to me about that in person and thinks that would benefit them, then I'm happy to do so, because I think that'll be quite cathartic for me too. I was very fortunate in that my support network was very good and very understanding, and looked after me, came to visit and whatnot. Yeah, even when people had stuff on at the time, like exams and stuff, they'd still call in, so that was good. And then I guess I've just been seeing inpatient or outpatient services since, and got on the right medication and stuff, and it's been not plain sailing, but it's been good since, touch wood. Well, I guess it's particularly important for us because as medical students we're going to be around sick people all the time, and that's going to impact, and that's going to, not all at once, but for instance, not tomorrow or the day after or in a week's time, but long term there's like worries of burnout and things like that. I would say that if you're worried about yourself in quite a big way, and I think medical students in particular can be, you can sort of get that hypochondria, you'll be in a neurology lecture and start talking about schizophrenia, and then all of a sudden, oh, maybe I'm schizophrenic, and then that sounds perhaps a bit silly, but that's an experience that I had, and I went to mental health assessment services at the Royal Edinburgh. It's this 24-hour, clinic almost, where you just rock up at the Royal Edinburgh Hospital, and a nurse or whoever's on call will just see you and talk things through with you and explain what they think your story is. And I personally found that really helpful at the time, so I'd recommend that to anyone who's struggling and doesn't really know where to turn to. I think the stigma has lifted. I mean, it's obviously not totally gone, because then we perhaps wouldn't need to do mental health weeks, but yeah, I'm sure, I don't know to give an accurate time on it, but maybe 5 years ago, even as far back as that, people wouldn't have been comfortable saying to colleagues and friends and patients and bosses and whatever, look, I've got this condition, and it has the potential to affect the way I'm going to interact with the workplace and the decisions that I could potentially make, etc., etc. So yeah, I definitely feel that there's support there. I think sleep's so important. I think that's my one, is I get sick pretty quickly if I'm not getting my 8 hours in. Eat well, get some exercise in. I know timetables and schedules are already full enough as it is, but it's important to make time. Yeah, also relax when you get the chance, because that's important too.